Thank you, Speaker. Firstly, my condolences to the Massa family in the loss of their son, Joe. It is a great, great shame when any life is lost, especially a child. Their strength has led to this law change. I'm very supportive of the regulation and change of law that will stop the proposal for linking private and public hospitals in what was clearly a poorly thought out policy, one that looked to save funds through the public-private partnership or PPPs. During the same period, that discussion about these partnerships, the community in my area came together through a number of groups, including Public Health First, with some leaders called Edna and Peter, and fought the plan, like other hospitals, to bring Bowral Hospital in line with the same plan. Bowral was due for an upgrade, and it was a potential candidate for the option of joining the public-private partnership for hospitals. And I too remember the protests outside the hospital with the people on the back of trucks with loudspeakers. They protested against the PPP, saying it was not going to offer the best outcome. And how right were they? We were offered not only a glossy new paint, but we were offered new buildings, and they held strong the community all together. And the government caved, but also offered new buildings and more services. And this is still a matter of contention for my community because we didn't actually get the continuation of the money that we were promised. We wanted a larger hospital and more services, not less. While the PPP was defeated with a private hospital being built alongside on the neighbouring block, the funding was cut for the promises and now we get retrofits. We're in discussions with Health to ensure that clinical services plan will be written to take up on board the growth that my area faces today. The desire for the government to provide but avoid costs and responsibilities is what's led to this decision of the PPP at Northern Beaches. The bureaucrats recommended a cheaper option, but the cost of the lack of oversight has had such dire consequences as we now know. Public health should be seen as a matter of pride. Why both parties in Australia don't compete to provide more like the UK services is totally beyond me. I'll always fight for health services like specialist workers and extra services for the region, and our staff in these hospitals do so much. And I fight this not only as an independent for my own area, but for all the others in the New South Wales. And while no services are perfect, the terrible outcome for this family should warn us all that saving money is not the major consideration when it comes to health. I thank the government for working with the crossbench with this bill, and with its support, we won't risk another PPP in the hospital system in the future.